Dr. Tran, tell me about the obturation technique that you use most commonly and then why you choose it.
Okay. So as an endodontist, especially with the way modern endodontics has been trending towards more conservative, more restoratively driven treatment, we tend to instrument smaller and conserve more tooth structure. So now I'm able to obturate in more of a single cone or hybrid single cone and continuous wave technique. In many ways, with the great options of bioceramic sealers that we have now, we can use single cone or like a hybrid method of using multiple cones, kind of like a lateral technique as well. And it helps really push the sealer because the sealer is what's doing the sealing within the canals.
Absolutely. And what drew you to the bioceramic sealers?
Well, we know that in endodontics, it's all about trying to heal tissues. In endodontic treatment, we're trying to heal the pulp tissue, heal the apical tissues, heal the periapical tissues and the bone as well. And so with bioceramics, it's a fundamental aspect in endodontics for bioactivity and bioactive materials. So knowing that we have the option of having the sealer be bioactive as well is phenomenal.
Do you use just one sealer, or do you pick and choose depending on the location of the tooth?
Well, sometimes it depends on the sealer and the material that I'll use. Does depend on what kind of case I'm doing. So certain cases that are really large, certain cases that are really small, different. Yes, just like any dentist and any clinician, it's really good to have every tool in your arsenal.
What would you say some of the main reasons that you see in root canal treatment fail over the years?
The most important issues are improper cleansing and improper sealing of the tooth. So by having better ways to seal the tooth properly and clean it and have a more antibacterial environment for that, it's all the more better for healing.
How do you get most of your retreatments referred to you, and how could those failures be reduced?
So with retreatments, that's unfortunately when the root canal treatment has been contaminated with bacteria. And that can happen for a lot of reasons, whether it's caries or whether treatment has been attempted by another dentist. However, the most important part with a retreatment is recognizing that it has been contaminated with bacteria, it's causing disease, and we need to remove the existing root canal treatment and disinfect the area. So my colleagues, luckily I have work with a lot of great referring doctors who refer me these cases because they know that they want to make sure that the entire tooth is fully disinfected and cleaned prior to restoring it, and so that they can do a beautiful restoration on top of a healthy tooth.
Any suggestions that you would have to general practitioners that are looking to increase the amount of root canal therapy they do?
The first aspect of understanding what kind of cases to do and increasing the number of cases to do is definitely improving diagnosis. But then in terms of the treatment itself, it's starting just like we all do from dental school. Practice, starting with easier cases, really studying the anatomy, really studying the best practices and the highest level of treatment possible. Thanks to like many technological developments in endodontics, it's easier than ever to make sure the tooth is very clean and well treated.
Any particularly complex cases that come to mind, and really what technique you use and why you chose that particular technique on this case?
So some of my favorite cases are a combination of like really sexy curved canals and really delicate curvatures, because when I see that beautiful fill on that radiograph where it's fully respecting the anatomy of the tooth while still treating all aspects of the anatomy, all the delicate little three-dimensional fins and isthmuses and all the complexities of the root canal treatment, knowing that I was able to use the technology that we have in endodontics to fully treat it, fully clean it, but also respect it while removing less tooth structure and making it as healthy of a situation as possible is the best option. But also, on the other hand, another type of case I really enjoy doing are saving teeth for children and actually not doing the endodontic treatment necessarily, or regenerating tissue. So vital pulp therapy and pulpal regeneration are vital aspects and vital procedures in the endodontic arsenal. And as an endodontist, unfortunately, I see so many kids who need endodontic treatment and who aren't able to get it. And so being able to maintain those teeth for the children, to try to maintain it for as long as possible, is so important.
Awesome. If you could design the ideal sealer, what would it do?
I think bioroot flow is getting pretty close to as ideal as possible. If it could magically, literally kill every single bacteria in the canal possible, I think that would make it perfect. But there's no such thing as full sterilization, not until we extract the tooth and like stick it in the autoclave. So in the meantime, bioroot flow is pretty darn close. It flows really well. It's biocompatible, bioactive. It's antibacterial, has all the features of a great sealer that I love, as well as the sealer itself is doing the sealing and the obturation.
Awesome. We'll let you off the hook.
All right.
Thanks so much. It was great.